President Joe Biden's administration is moving to expand access to COVID-19 vaccines. Distribution's becoming even more urgent to prevent the spread of the potentially more serious strains of the virus. Starting next week, the Biden administration will ship 1 million doses to thousands of pharmacies. The administration hopes to eventually expand to 40,000 pharmacies.
Sites are selected based on their ability to reach some of the populations most at risk for severe illness from COVID-19.
This is expected to help alleviate concerns about inadequate vaccine supply.
And we've learned some of those pharmacies will be here in Hampton Roads.
28 CVS stores should be ready to schedule appointments a week from today, and our Brett Hall explains how it will work.
Those frustrated waiting to receive their coronavirus vaccine from a health department or private provider may soon have another place to turn to, their neighborhood drugstore.
Excited to be a part of this solution for Virginia to ensure that we're helping to get more shots into more arms.
CVS says they will begin vaccinating people in both priority groups, 1A and 1B, on Thursday, February 11th. Select stores in Chesapeake, Newport News, Norfolk, and Virginia Beach will be among the first to receive the initial 26,000 doses.
It's been a Herculean effort. We're certainly humbled by that. My teams are humbled.
A spokesperson says we won't know exactly which stores will have the vaccine until they are shipped, but what we do know is that walk-ins will not be welcome. To reserve an appointment for the free vaccine, you'll need to go to CVS's website, their mobile app, or call their 800 customer service number. Again, do not call yet, as no appointments are being accepted until Tuesday, February 9th. We'll have that number ready for you at that time. Several North Carolina Walgreens stores will also vaccinate people for free starting February 12th. Again, you must make an appointment. Pharmacy representatives say those who will administer the shots have been helping vaccinate those living and working in nursing homes.
We've got a dedicated team of healthcare professionals, pharmacists, nurse practitioners, and technicians that are helping us with this endeavor.
They're ready to keep moving forward. Spokespeople from both pharmacy chains tell me that they will be expanding the program, of course, when the supply becomes available. That's the latest. Brett Hall, 10 on your side.